Hi, my name is Dylan Volpe. I'm a physician assistant student here at Lipscomb University. I chose to do my professional practicum project on Alzheimer's disease, specifically comparing the combination of Donepezil and Memantine versus Acudanumab, new monoclonal antibody in the treatment of Alzheimer's disease. First of all, Alzheimer's disease is a progressive neurodegenerative disease and growing in prevalence. The defining characteristics of Alzheimer's disease include the accumulation of amyloid beta plaques and tau fibril entanglements within the brain. Signs and symptoms of Alzheimer's disease include memory impairment, executive dysfunction, visual spatial impairment, as well as behavioral symptoms. Current therapy includes or involves acetylcholinesterase inhibitors, for example, Donepezil, as well as N-methyl D-aspartate inhibitors, which is like Memantine. So currently no therapy halts or slows disease progression. It doesn't even target hypothesized pathophysiology. What it does is it masks symptoms and kind of gives patients a little bit, gives them a little bit of quality of life back without slowing any progression of the disease. Now, Acudanumab is a new monoclonal antibody under review by the FDA at the time of this study that targets amyloid beta plaques and tau fibrils within the brain, making it very important because it could potentially slow or halt progression of the disease. For my study, research was conducted on several search engines, including PubMed, Trip Database, Google Scholar, and UpToDate. First of all, I wanted to establish that Acudanumab or Donepezil Memantine combination therapy actually were the standard of care for moderate to severe Alzheimer's disease. And I did that by referencing UpToDate, which is a database that healthcare workers can easily go on and determine appropriate pharmacotherapy for almost any disease. And through that research on that website, I was able to establish that as the standard of care. Referencing the poster, if you look at figure 2, this graph compares monotherapy of Memantine and Donepezil versus the combination therapy as well as with a placebo. With Memantine and Donepezil being in the blue color, you can see just how effective it is compared to a monotherapy or placebo. Several tests were used to measure global clinical status, behavior, activities of daily living and function, as well as like cognitive function. All of those tests were used to determine the effectiveness of this drug. Referencing figure 3, now we're looking at Acudanumab versus placebo at 24 weeks. So this does the same thing. It measures cognition and function as well as, but also beta tau levels within the CSF. So the only difference is with these two studies, they're using two different tests, the ADAS cog test and the CDR-SB test to measure cognition and function, whereas in figure 2, different tests were used to measure the same outcomes. What's important is the CSF tau levels were greatly decreased. You wouldn't find that in Memantine or Donepezil because they're not targeting those things. Down at figure 4, this is a chart to illustrate some of the side effects that are seen with Acudanumab. The most common being a self-limiting headache, but the most serious being some cerebral edema, and only 2% of the patients within the trial experienced that. It was self-limiting and resolved by day 106 of the study. So to conclude, Donepezil and Memantine combination therapy is first line for moderate to severe Alzheimer's disease. but it only treats the symptoms. Acudanumab shows to target two of the following hypothesized causes of Alzheimer's disease, being amyloid beta plaques and tau fibrils, as well as it improves cognition and function. It does show some minor side effects in a minority of test subjects. Cerebral edema was self-limiting. It was determined that it was a major adverse event, but it was self-limiting, resolved by day 106. And weaknesses for this study included aducanumab being tested in newly diagnosed and mild Alzheimer's disease patients. And it was different tests were used to measure efficacy, such as cognition and function, leading to an indirect comparison. Thank you.